My name is Carlos. For this video, I'm going to be demonstrating how to do an IM injection. I'm going to start off by walking into my patient's room. I'm going to identify myself. I'm going to identify my patient by their wristband, verify their name, date of birth. I'm going to verify my physician's order, make sure that my medication order is on the MAR, compare the medication that I pulled to the MAR, and make sure that everything is correct. I can then wash my hands, don some clean gloves. For demonstration purposes, I'm not going to be putting them on. I can then get my vial, pop the top off, disinfect. I would want to do a focus assessment based on this medication. For this demonstration, it's Haldol, so I'd want to do like a psych assessment on my patient. So then I can clean, I can get my needle, I'm gonna open my syringe, I'm gonna verify that my order, it's 4 milligrams of Haldol. This training vial is 5 milligrams per milliliter. So I'm gonna do 0.8 milliliters of Haldol. Pull back 0.8 milliliters of air. I'm gonna inject that into my vial. I'm gonna then withdraw 0.8 milliliters of Haldol, making sure there's no air bubbles. I'd be using a 20 to 25 gauge needle. If it's a medication of watery consistency, if it was an oily medication like Ativan, I'd probably want to use like an 18 gauge needle. So then I've got my 0.8 milliliters of Haldol. I can then recap my needle. I would then want to switch these, get a new one, dispose of this one in a sharps container, get a new needle. Got my new needle on there. Verify that this is correct. Verify the dosage. Go into my patient, re-sleeve it if I'm outside my patient's room. Write the dosage, the medication name, patient's name, date of birth, room number, all on this package, just to make sure that everything is correct. Once I get to the bedside, I would do a third check, verify that everything is right. I would then explain the procedure to the patient, explain why they're getting this medication. If this patient is getting Haldol, they're probably not going to understand why they're getting that medication, but you're going to try to explain it to them anyway. You can then pick a site. There's 4 places you can pick from. You can do the deltoid, you can do the vastus lateralis, you can do the dorsogluteal or the ventrogluteal. Typically, you just pick the deltoid for a healthy patient. The other best choice would be like the dorsogluteal, ventrogluteal area. Vastus lateralis is usually for children. But I'm gonna pretend this lemon is my deltoid. I'm gonna clean that side off. I'm gonna be using a Z-track method when I inject my needle. It's kind of hard to demonstrate on a lemon, but you're gonna pull the skin taut while injecting your needle at a 90-degree angle, and then you're gonna release the skin so it pulls back and medication doesn't spill back out of the injection site. So I'm gonna insert my needle at a 90-degree angle. I'm gonna push in my medication, 1 milliliter per 10 seconds. So for demonstration purposes, I'm just gonna push in the medication, but you would do 10 seconds per milliliter. Not gonna recap this needle, I'm just gonna dispose of it in a sharps container. Place a cotton ball alcohol swab on the injection site, place some pressure on it. I can then take off my gloves, wash my hands, document in the chart how much medication I give, the patient's response, and then later I can do a follow-up assessment and see how the patient tolerated the medication and the expected response to the medication.